A lot of patients will come to me with shoulder pain. Yes, it is not that uncommon because shoulder is a big joint which is supported by lots of muscles because of many reasons, like any kind of medical history like diabetes or thyroid or rheumatoid arthritis, or because of aging or because of injury. A lot of patients will have frozen shoulder. Now this frozen shoulder is a condition where initially you will have pain in the shoulder and slowly eventually it will lead to restriction of the joint movement. And it passes from stage 1 to 2 and then 3. And in stage 3, when it is completely frozen, that is called as adhesive capsulitis, you will be unable to lift your hand. Now, this frozen shoulder can be very troubling, especially if it's on your right hand and if you are a right-handed person. So make sure to identify few symptoms that can lead to frozen shoulder. Now, what are these symptoms? Number 1 could be stiffness in the joint. Stiffness you may feel here or in the arm. Second could be difficulty in lifting objects. For example, even your phone or some heavy weight like your bag, lifting these things can also be difficult. Third thing is pain at night. Very commonly, a lot of patients will come where they will have pain at night, a pulling kind of sensation at night. This could be because of impingement syndrome. And very commonly, what the patient complains to us is that they find difficult while combing, they find difficult while buttoning their shirts, they find it difficult while putting their hand backwards. So this can be sign of rotator cuff injury. Now this is our shoulder. This is a model which shows shoulder, and shoulder joint is a joint which is formed by 2 bones and supported by lots of muscle, especially 4 muscles which are called as rotator cuff. These are supraspinatus, infraspinatus, teres minor and subscapularis. Now, to maintain the integrity and the stability of the joint, it is very important that all your 4 rotator cuff muscles are at place and are healthy. Most commonly what we see is gym injuries. When you go to the gym and you're trying to lift heavy objects without any supervision, you can tear your rotator cuff muscle. Second thing is uncontrolled diabetes or uncontrolled hypothyroidism, or in patients who are suffering with rheumatoid arthritis. So all these patients can lead to rotator cuff injury. So how to identify? There are few tests which your doctor will do. These are called as active and passive test. Active test is when the patient will do the movements and the doctors will check. And passive tests are when the doctors will do the movement and they will check. So in 90% of the cases, we identify what is the problem, which muscle is involved, whether it is a rotator cuff muscle or whether it is a joint problem. We can identify that easily with our test. But to confirm whether we are correct or not, we need to do certain investigations like ultrasound. A dynamic high resolution ultrasound scan can give us 100% accuracy of what the problem is. But in few cases, we may also have to require MRI of the shoulder, for example in labrum tear, which ultrasound can actually not identify. So once we are complete with the history, we know we have done the test, we have our investigations ready, then next what? So a lot of time patients will say that they are suffering with this kind of frozen shoulder or rotator cuff injury since long, and it has become so chronic. They have tried physiotherapy, they have tried other modalities of treatment, but still they are suffering. So shoulder pain can be treated very easily with injection therapy. We have lots of injection techniques like prolotherapy. Then we have some proliferative therapies where you don't need to undergo any kind of surgery and you don't need to suffer as well. So with these injection, if it's a rotator cuff pathology, if it's a frozen shoulder pathology, or whether it is any kind of arthritis that has set in, can be treated very easily. These procedures are done in around 20 minutes in operation theatre under ultrasound guidance, so that we know that what we are treating, where our needle is, and then followed by few exercises specifically for your shoulder mobility, stability, and for your rotator cuff strengthening. So we make sure that we give you a holistic approach so that you don't need to suffer with your frozen shoulder pain or your rotator cuff injury or sports injury or any kind of gym injuries. So for more information, do follow our page because we have lots of information regarding lots of other types of chronic pain, be it knee pain, shoulder pain, hip pain, spine, back, sciatica, spondylitis. So do follow our page.